dystrophy that are best differentiated by electromyography. So that's parent-doctor teamwork in terms of the symptoms. And then we have got the genetic testing of the blood sample. And then we have got electromyography, and then the other one is a muscle biopsy, a small tissue of the muscle, and that can help differentiate either SMA from other different types of muscular dystrophy. There is a couple of labs that have to be done, a couple of markers that they need to do to be sure that you are good to receive Zolgensma, that it's absorbed maximally and doesn't cause problems. Now, Zolgensma works on this main SMN protein that is defective. It replaces this one, brings in its own, and it does the same job, okay, of what this would be doing. That's what Zolgensma does. Good humans, we are winding down. First of all, I know, every once in a while I clean up good, and my little human is sleeping now. So let's get this going. Today is almost winding down, if not winding down, on the series all about SMA. Today I'm going to cover a couple of things. 1, diagnosis. 2, the treatments that are available. And 3, the medical management in general. Now, like I said, every child with SMA is very different. They all vary. Their abilities and degrees of abilities are all different. And so you can't bunch them all in one thing and say everybody has to have this. At some point, in some varying degrees, everybody will need some form of the medical management that I will mention. I am not a medical doctor. I'm just a mama who has learned her way around these things. I do have a healthcare background, but for details on your specific patient, please consult with your doctors. Listen to your doctors, listen to your respiratory therapist, listen to your therapist, physical, OT, speech, or anybody like that. But this is at least a general guideline to get you knowing where to go. Alrighty? So, shall we get going? We are going to get into diagnosis, treatment, and a little bit of medical management. Shall we? Alrighty. Alrighty, good humans, welcome back. Okay, now spinal muscular atrophy. We have covered quite a lot, and I'm hoping that everybody now who was with me until now has been able to go through the whole series so that you will understand about diagnosis. Okay, now first thing, time is motor neuron. Do you remember that saying? Time is motor neuron. The earlier you get the diagnosis, the better it is for you to access treatment early so that you do not lose a lot of motor function, okay? So time is motor neuron. When it comes to cardiology, the heart, we say time is muscle. When it comes to strokes, we say time is brain. I am introducing in neurology and SMA, time is motor neurons. We got to start these treatments as soon as possible. The other thing is, due to newborn screening, that has been possible so that especially during at newborn screening, then the people are able to access the therapies early. They don't lose a lot of motor function, and so they're able to regain a lot of muscle bulk, a lot of muscle function, and the ability to have the medication just allows them to be able to build onto that. Now, part of this series, the reason I'm doing it is so that to bring awareness about spinal muscular atrophy, because aside many countries, there's so many countries that do not have access to the treatments that are available. Like my home country, Kenya, there is no treatment available. And whilst I could do the advocacy to bring the treatments, it is also important to put the knowledge out there about spinal muscular atrophy, so that when you're doing the advocacy to tell people to sign this, to walk with you on this journey of advocating for treatment in all the many countries that do not have access, then they have an idea what spinal muscular atrophy. Okay, so many parts to a tree, and I am just a small part, and I'm hoping this part of educating people on SMA will help. Alrighty, so let's go in. Diagnosis. Now, the most important, and I think what is missed most, is the initial examination and listening to the parent. I truly believe that for the better part, muscular dystrophy, any form of it, is early diagnosed by a parent. You will notice things are not happening as they should, milestones are not being met as they should, or there is regression where there was progression. And so for the better part, most of the diagnosis would happen early if doctors would listen to the parents. It took me a long minute for me to get a doctor who will listen to the problems that I was having or the symptoms that I was seeing. And if the doctors would listen, then that is usually, the parent will usually have most of the things dialed down, and then they can take on the other bit of it as a doctor, you know, to get their labs done and to examine for themselves. But I think it's very important to say that the parent usually will have noticed a parent, a grandparent, something off about the milestones not being met. Okay, now the other bit is if you have had someone or a family member who has had spinal muscular atrophy before, then that usually will trigger an earlier examination or an earlier testing, so that you're able to get access to treatment early. Again, with newborn screening, now we're able to access treatment from the get-go. Alrighty. Now, that is one. Doctor examines and the parent brings it up with all the symptoms they're seeing, and the doctor examines, and so that unit, that teamwork starts very early from the parent and the doctor. Okay. Now, the other way is a genetic test, and that is usually a blood sample is the most accurate, and they will take a blood sample of the person who has the symptoms. They will send it out. Usually results take about 2 weeks. It may be faster now, but when we were doing for my son, it took about 2 weeks, and then you will get the results, and those results will guide the therapy that they can give at that time. Okay, so that's the second one, so to speak. The third one that can be done is electromyography. In the heart, they do electrocardiography, study the muscles of the heart and the nerve impulses. In muscles, they do electromyography, myo for the muscles, and that will kind of give an idea of where the muscles and how they're receiving impulses and stimuli from nerves. Usually, this will be done mostly for the later types of spinal muscular atrophy, because there's two. There can be a variable many diagnoses, differential diagnosis that can be there, and so they can include that in early. Also, there are other types of muscular dystrophy that are best differentiated by electromyography. So that's parent doctor teamwork in terms of the symptoms, and then we have got the genetic testing of the blood sample, and then we have got electromyography, and then the other one is a muscle biopsy, a small tissue of the muscle, and that can help differentiate either SMA from other different types of muscular dystrophy. Remember, I said this is an umbrella. There's so many of them in there, and so you need sometimes to differentiate exactly which one is presenting in which way. But at least for the SMA that my son has with SMN deletion, the problem with the SMN protein, that one with genetic testing, you can capture it. Okay, so that is diagnosis in a nutshell. That's quite truly it. Okay, and then now next we are going to cover the treatments that are available and the 3 types of medication that are available. There's still ongoing research, ongoing clinical trials on those on new ones to come up, but I will cover the 3 that are there, and then we can move to medical management. Alrighty, see you in a bit. Alrighty, Ready? Okay, now treatment. I'm going to bring in my props. Remember this? So remember we said that you have normally you have a normal SMN, this one, SMN protein that will give nutrition to the motor neurons, and then they're able to move the muscles. Okay, when you have a defective SMN protein, which is this, then your muscles do not get the motor neurons do not give the muscles the impulses they need for the muscles to move. Okay, now the treatments that are available are three. One is called Spinraza, nusinersen. And what Spinraza does, it works on a backup protein. Remember we had said that you can, in SMA you have got two SMN proteins, and there's a backup protein that is just chilling, that is not fully functional. It doesn't do the job as well as it should. And that backup protein, when they're doing diagnosis, they will usually check how many copies of that you have. Some people have one copy, some people have two copies, some people have three copies. I've even heard of 4 copies. Okay, the more the copy you have, the more the bulk of the medication you can hold on to, the more nutrition you can give to your motor neurons, and the more the muscles that you can get going faster. Okay, so the more the copies, the better. So nusinersen usually works on that backup protein, and it wakes it up. It gets it moving faster. It gets it churning SMN protein faster, so that you're able to give nutrition to the motor neurons and your muscles move. Okay, so that's the first one, Spinraza. Now Spinraza is given through the spine, like a lumbar puncture directly into the spine. And because of spinal curvature differences in children or in people with SMA, you can have usually it's at the lumbar area, but I have had people who have had it done in the cervical area, just because either they had spinal rods put in early, or the curvature of their spine makes it very difficult to access the lumbar area. So that is something that you will discuss with the doctor, and they will find out what works best for you at that point, what you're comfortable with, what they're able to access easiest without much problem. Okay, and because it's lumbar puncture, it's usually done in the OR, and it's done every 4 months. Usually you have a loading dose of loading dose, and then every 4 months. Okay, so that's Spinraza. And then the second one that still works on the backup protein is Evrysdi or Risdiplam. I'm not paid to talk about this medication. This is just giving information. Evrysdi or Risdiplam. Evrysdi is like every day, but Risdiplam. Okay. Risdiplam also works on the backup protein. It is an oral medication that is given every day at the same time, and that also works on the backup protein to get it churning out more SMN protein, so that you can have motor neuron health, so that you can have the muscles working. Okay, so that is 2 of them that work on the backup copies of SMN protein. Remember we said we have 2, and then we have a backup copy, and the backup copy you can have a couple of them. You can have 1, 2, 3, or 4. Now Nathan has 2 copies of the backup protein, and so the medication, initially we started with Spinraza, and then he didn't do too well with anesthesia. It took too long to get wear off from his lungs especially, and then we switched to Evrysdi, and he's been on Evrysdi every day. I give it as an oral solution every day via his G-tube. Okay, so that's the second one. The third one is Zolgensma. Zolgensma is given as an IV infusion, and it's given over around 1 hour. There is a couple of labs that have to be done, a couple of markers that they need to do to be sure that you are good to receive Zolgensma, so that it's absorbed maximally and doesn't cause problems. Now Zolgensma works on this main SMN protein that is defective. It replaces this one, brings in its own, and it does the same job. okay, of what this would be doing. That's what Zolgensma does, okay? So 3 of them. Nusinersen or Spinraza works on the backup copies, and it helps that churn more SMN protein. Risdiplam also works on the backup copies, and that helps it churn more SMN protein. And then Zolgensma is the 3rd one, and that one literally works on the SMN1, and that one will help it just replaces and does what that one would be doing, okay? Now that one is in IV. Spinraza lumbar puncture, Eveready is oral or G tube, and then or NG, whichever mode you're administering through, and then Zolgensma is IV, okay? For the IV you need, there's a couple of titers that they will check, and the doctors will advise you, and they will monitor so that it's safe for the child and is absorbed maximally, okay? So those are the 3 medications that are there. Now in the next one coming right up, we will review a few medical managements, and then we can wind this down. See you in a bit. Good humans, alrighty, let's wind this down. Remember, this is as simplified to a basic level as it can be, okay? More details can be given to you by the doctors and the providers. You will most likely have a primary care provider and a neurologist so that you can glue all these therapies together and treatments and decide which one will work best for you. I need to add that Zolgensma is given from 0 to 2 months. 0 to 2 years. 0 to 2 years. The others can be accessed by everybody across the spectrum. Alrighty. Now, medical management. This varies vastly, okay? But for the better part, most of the things that I will mention are at least a baseline for just about everybody who has SMA. It may vary in degrees of what is in and out, but for the better part, this is at least just a baseline that touches about everybody, okay? Now, remember we said spinal muscular atrophy affects the muscles of swallowing and eating in some people. And that means that very early on, you will need to decide what form of nutrition works best. If they can eat orally, are they able to absorb everything and get all the nutrients and the calories that they need? If not, like Nathan was, because his muscles were affected, then you need to quickly skip over to either an NG tube or a G tube or a GJ, depending on the person, okay? And a gastrostomy tube goes directly in the stomach, and then you get nutrition directly in the stomach. It's usually formula, and again, that will be determined by you and the doctor, okay? The formula that is used for the better part is just standard formula, but there's different variabilities because of how in SMA you metabolize you break down your fats and your proteins and what is needed, and so there's a varying I want to say a scope of what you can feed the child, okay? And some people have preferred amino acid diet. I don't have details on that, but and then others have preferred formula, and then others have preferred blended diet, and it's a scope that you and the doctor can sit down and the nutritionist and decide what will work best for the child so that it can get good nutrition, okay? So that's nutrition. Respiratory wise, remember we said we have problems with breathing because your intercostal muscles are weak, and so there's problems with breathing in and out. There's problems with cough generation, secretion clearance, and so very early on there's a decision that will be made on, do we need to have a tracheostomy or do we need to have non-invasive ventilation? And that could be like BiPAP is the most commonly used, okay? And that will be a mask. It can be nasal. Some people prefer full one, or some people prefer the nasal prong one, and that is a decision that you will talk with your pulmonologist as a parent, and they will guide you, okay? Initially for my son, we decided on non-invasive ventilation, and he did that for a while, and then we switch to a tracheostomy, which is a hole through the trachea, and you connect that to the ventilator, different modalities, and those will be decided again by the pulmonologist and the area respiratory therapist, and you and the child, or the person with SMA. That is what will decide what works best for them. Okay. And then also for respiratory, aside the ventilation bit, you have to have help with secretion clearance, and so you will need a suction machine. You will need a cough assist machine, and that gives air as a gush and pulls it out. As it pulls it out the secretions. And then you will need a shaky vest, what I call shaky vest. It just shakes the chest and loosens the gunk in there, and then you're able to pull it out with a cough assist and suction it out. Okay, so these are things that you will be able to discuss with your pulmonologist, and usually they will just bring them up because they're almost in the baseline management of spinal muscular atrophy. Okay, so we worked on nutrition, we've worked on the chest. Spine, remember the core, we said you have a weak core, and so you tend to have either a lateral curve or a C curve, and so for those ones you will need bracing initially, and there's so many different types of braces that you can put. There's a hard shell one, and that kind of just keeps the spine in alignment, and there's very varying different ones that you can use for to brace. My son could not tolerate the hard shell one because it stopped the breathing of the abdomen, which he needed or he needs, and so sometimes that gets in the way with most people, just because the hard shell one stops the abdomen from moving. And so there's different varying degrees of braces that you can use. He tolerated what is called a spio vest, and we used that for a while until then the curvature. The doctors will do x-rays frequently, and then they will decide when you can either fuse the spine for all the kiddos or put spinal growing rods for younger children. Okay, and so in the meanwhile, you will need to use a brace, some form of stability, just to prevent the curvature from progressing too fast. And that will usually be in conjunction, or besides the brace, then you will do other therapies, physical therapy, occupational therapy. You can add on aqua therapy, which we did with Nathan, and all those will help strengthen the muscles. Remember, we said if you don't use it, you lose it, and so you've got to keep muscles moving. And then the other thing that you can do in terms of therapy is standard therapy, just to get the muscles moving and also keep your hips in alignment. And then when you're not walking, you lose a lot of bone density and you can cause fractures easily. Being on a stander kind of helps simulate standing like a normal person and strengthen your bones. Okay, some people may end up needing bone infusions just to add on to the bone strength and prevent fractures. And so for lifting, then you will need to be safe on how you're lifting, because then you could break bones easily. Alrighty, I think I have covered everything. No, the legs you will need some form of orthotics. You see them on the ankles or the knees. You will need some form of orthotics just to keep the tendons stretched, so that you prevent contractures early. Okay, each client tolerates orthotics differently. Some are able to have them all day, some are not able to have them all day. So again, that is a decision you will need to talk with your doctor and see what you can come up with that works best for the person at hand. Alrighty, and quite truly, that is it. Varying degrees of this management. This is as basic as I can put it, so that anybody who sees this can be able then to just have an idea of where things will be or how things will be going for their family member. And this is just as basic as it can be. For the better part, most providers and hospitals have a good system on what they do with spinal muscular atrophy. And if you are not, then you will need a primary care provider and a neurologist, a pulmonologist for the lungs at least, and a GI doctor for the food and the formula, just to get things going for you. Alrighty, now I'm going to say again, I'm not a doctor. I am just a parent who has learned things as I go. Some of these things I will go into detail much later and explain each and every one of them, like section and cough assist and how they work and how I use them on my child. But at least for a baseline of SMA, those are the things that are needed. Alrighty. Now, if you have any questions, put them in the comments. Also, if you know anybody who has spinal muscular atrophy, they can chime in right here. If there are any providers who are listening to me, please chime in right here. And then for everybody, I am very appreciative of you listening. This has been a series that I have been wanting to do for a long time, and so I'm very, very thankful for walking along with me or listening along with me. I am very, very thankful. When my son was diagnosed with SMA, it was a lot of information overload, and yes, there's a lot of information that you can Google and get, but I wish there was a video that I could put and listen as I am doing other things, and continue to listen to a couple many times as I'm doing other things, driving or going for an appointment or doing housework or doing medical care. It was something that I really wished, and I'm hoping this will at least be just a small piece that would help a parent so that they're not overwhelmed as they are, alrighty, as it can get to be, alrighty. And so that's it. Thank you very much for listening. The next series I'm going to start will be interesting, but not before. Actually, the next one I'm going to do will be about our journey from A to where we are now. A little bit of everything, and I'll try to do that. So stay tuned in. Keep sharing, keep liking, subscribe to my YouTube channel. I am very, very, very thankful for each and every one of you. God bless you so much. Thank you very, very much for listening in. Adios, good humans. Bye-bye.